Together we achieve victory over heart failure.
Essential insights on heart failure. Hello and welcome to our podcast. I am Dr. Naresh Munot, interventional cardiologist practicing in Pune. Today we are delving into a silent epidemic that India is combating, which is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It is a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of the elderly. So, let us break down 5 essential insights on heart failure. Number one, firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it is the end of their lives. The term heart failure can seem frightening, but it simply means that your heart is struggling to pump blood as efficiently as it should. The ejection fraction, also called EF, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, which each time when it contracts each time. While a normal EF is around 50 to 70%, individuals with heart failure typically have an EF of 30% or lower. Number two, why are so many Indians affected by heart failure? So, genetics also plays a very significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen this epidemic. Number three, moving on, what are the signs and symptoms of heart failure? So, you should always watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, and weakness. There is also loss of appetite or vomiting at times in patients with heart failure. Number four, how can we protect ourselves from this disease? So, we all know that our hearts work incredibly hard to keep us alive. These are 5 golden rules that we can follow to return the favor. One, early detection of heart failure through regular blood tests. Second, dietary adjustments to maintain heart health. Third, incorporating daily exercise into your routine. Fourth, practicing stress management techniques. And fifth is quitting alcohol, tobacco, and smoking. So, fifth and the last essential insight on heart failure is what comes next after a heart failure diagnosis. Thankfully, medical science offers numerous treatment options. It is possible to lead a enjoyable, meaningful, and productive life even with heart failure. Heart failure medications improve your quality of life and longevity. Devices like biventricular pacemaker, implantable cardioverter defibrillator, and heart valve repair or replacement are available. And a last resort treatment option is also heart transplant. So, with the progress in the treatment options of heart failure, people are able to live a better life. Finally, the lifetime risk of heart failure is 1 in 5 for both men and women. So, remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.